the KUGI endoscopy how-to video for using the Minnesota tube. So first we're going to talk about what supplies you need, and they're right here. First thing is you're going to need your Minnesota tube, you're going to need your pressure gauge, you're going to need some Kellys, a couple of 3-way stopcocks, a couple of catheter adapters, a 60cc syringe, some tape, and some lube. That's your list right there. Alright, so once you have all the supplies that you need, the first thing that you're going to do is you're going to open up your tube. So when you open your tube, you're going to notice that you have adapters here where you can hook up suction, and also you can hook up, you can blow up the balloon and tell what the suction is. The way that you can tell what each of these ports is for is it's clearly labeled. Here it says gastric aspiration. So you know that this is the port for gastric aspiration. This one says esophagus aspiration. The ones for the balloons, you can tell they're the ones for the balloons because they have two different spots that you can attach something to. And they're also clearly marked. This one says stomach balloon. This one says esophagus balloon. So the first thing that you're going to do is you're going to pull out the little plastic stoppers inside for the balloon ports, because if you leave those in, the balloon won't completely deflate on either the gastric balloon or the esophageal balloon. And so we pull out those stoppers. The next thing that's important to know about the tube is it has markers for how far, for the length of the tube. Now it's also important to know that these markers, the start where it measures from, is this little area between the stomach and the esophagus balloon. And so this 25 means that it's 25 centimeters from here to here. So what you're going to want to do when you pass the balloon down is you're going to want to, because the G junction is at 40 centimeters almost universally, you're going to want to pass it down to at least the 45 centimeter mark. So you'll know that this transition zone is at least 5 centimeters past in the stomach. And so if you get it to the 45, then you're going to blow up your gastric balloon. And once you have your gastric balloon blown up, and you're going to use 450 milliliters of air, once you have your balloon blown up, then you're going to pull it back with a balloon full and tamponade and see if the bleeding is stopped. Alright, so before you insert the tube, the first thing that we're going to need to do is we're going to need to obviously lubricate the tube. So we're going to lube it up really well, and it says on the instructions that you can either go nasal or you can go oral. Probably the nicest thing to do is to go oral. So if you're going to pass the tube, you pass the tube OG style, but again, if somebody goes NG, it will work just fine. So you're going to pass the tube, and then the other thing that is important to know is when you are doing the instructions, when you're reading the instructions, it tells you to test the balloon ahead of time. Now, real world situation, if you're getting ready to test the balloon, you're going to have some very impatient physicians and staff members in the room because it's the patient's bleeding and everybody is feeling very nervous. And so a lot of times people go ahead and just skip the testing. The testing involves blowing up the tube and putting it underwater and see if there are bubbles. But if it's a very urgent case, which it usually is, you may just go ahead, take it out, and pass the tube. Once you get the tube completely lubed up and you figure out whether you're going to go NG or OG, then you just pass the tube down to where we talked about a minute ago, to the 45 centimeter mark. Then you're going to blow it up. Alright, so what you're going to use to blow up the balloon is you're going to use the 60cc syringe, you're going to use a 3-way stopcock, and you're going to use the catheter adapter. And so we'll just start opening the supplies and putting them together. So that's the 3-way stopcock, and this is the adapter. And so you can hook the adapter on like so, and then the next thing that you would do is we're going to do the stomach balloon first, and so that's the stomach balloon, and so we're going to attach this here. And then the next thing that you're going to need to do is get your hemostats ready. It's easier to just go ahead and use the hemostat for this. Now that's the reason, this is why we have the tape also. If you do the hemostat directly onto the tube, you can cause it to start to crack and break. So that's why we would put just a little bit of tape on each of the ends of the hemostat. And so you roll the tape around just to make it so it's not as sharp. And we'll do the same thing for the other side. And roll the tape around again just to make sure that it's not too sharp. So we're going to now clip off the end of the tube that we're not going to use. And now we would use our 60 cc syringe, and we're going to start blowing it up. So we know it's at 60, and you're going to start counting. And so you're going to go 60, and then off. And then you're going to go 60 more, and then off. So we're 120, 180, 240, 300, 360, 420, and then 450, and then you're going to turn it off. And once you have that completely blown up, you're going to use your other hemostat, which I pre-wrapped, and then you're going to cut off the balloon. And that's going to make sure that your balloon stays full. So this is down in the stomach, and so you're going to pull it back, and this balloon is going to tamponade any gastric varices that may be there. And so you're just going to hold, it's going to stay there in position. So you notice that we've got suction ports here. So now what you're going to do is you're going to hook your esophageal aspiration up to the suction. By the way, you'll want to have 2 suction setups in the procedure room that they're using. And so you'll hook up the suction to there, and what you're looking for is blood. And you'll get blood at first, but if the bleeding stops, then you know that you've stopped the bleeding and it was a gastric source, and you won't even have to worry about the esophageal balloon. But if the bleeding has not stopped, then you're going to have to blow up the esophageal balloon. Now, we have to use a pressure gauge with the esophageal balloon. And the reason why we do that is because if the pressure is too high, which is anything above 45 millimeters of mercury, it'll cause no circulation to go to the esophagus, and you'll end up causing more problems than help. So we're going to blow it up, and you start off blowing it up so that you only get to 25 millimeters of mercury and start low. So you get it up to the 25 millimeters of mercury first. So what you're going to do is you're going to open up your pressure gauge, which is right here. Now you notice you've got a power button on the pressure gauge. So your first thing you're going to do is you're going to turn your power on. The next thing that you're going to do is you can zero it out. You notice on there its bar is your units, and we want to go to millimeters of mercury. So you're going to hit the unit button until you get a millimeters of mercury right there. In order to inflate the esophageal balloon, you're going to create another setup. You're going to use your 3-way stopcock, and you're going to attach your blue catheter adapter onto there, and then you're going to find your esophageal balloon port, and you're going to attach your syringe there. With the esophageal balloon, the difference between this is that you actually have to know what the pressure of the balloon in the esophagus is. If you don't know what the pressure is, if the pressure is too high, it will cause necrosis of the esophagus. And so now we're going to attach the pressure gauge. There's no fancy attachment for it, but as it turns out, this green top here it actually fits in pretty securely into the port there. So if you just push that in together, then you won't need any other attachments. And now you're just going to start inflating the balloon until you get to 25 millimeters of mercury. So as I'm injecting you're going to inject until you get to your 25 millimeters of mercury. So I'm there now, and so I'm going to use my hemostat from the other balloon, the one that's not actually cutting everything off, and I'm going to clamp it off. Then you're going to check and you're going to see if the bleeding has stopped. If the bleeding has not stopped, you're going to go ahead and pull more air back, and you're going to have enough air in your balloon, and you're going to unclamp the balloon, and you're going to inject air until maybe you get up to 35 millimeters of mercury. And then you're going to clamp again, and you're going to see if your balloon has stopped. And you can keep on doing that until you get all the way up to 45 millimeters of mercury. And then hopefully the bleeding will stop, and you will be heroes. Alright, one last important thing for you to know is that the competency that we use and the procedure that the hospital has for inserting this tube, they're both kept inside in this pocket here of the pressure gauge suitcase. And so you can pull those out to refer to as needed. And another thing is this document talks about the aftercare and what to do with the tube after we've placed it. Now, we don't care that much about it, but the ICU nurse does care. And if they have questions and they're not sure how to take care of the tube, you can leave this copy for them up in the ICU. We keep this on the SharePoint, so you're welcome to reprint it back off once you get downstairs and put it back in the suitcase. Or you can also let one of us know, Greg, John, Kate, or I, and we'll print it off and replace it the next day. Thank you very much, and you have a great day.